Hello students, I hope you all are well and your studies for your exam are also going good. So in today's video, we will discuss about the classification of drugs used for glaucoma, and basically these are topical drugs, and what is glaucoma, its types, and site of action of the drugs acting on glaucoma, and some important points which you should know about drugs. So let's start the today's video. So, what is glaucoma? So, glaucoma, it is a group of diseases which is characterized by a progressive form of optic nerve damage, and it happens due to the raised in intraocular tension, which is denoted at IOT, and it is more than 21 mmHg. So, basically, in a glaucoma, actually, if we are know about the structure and function of our eye, so eye is that organ which is responsible for the proper vision, and it contains aqueous humor which is produced by ciliary body, and this aqueous humor maintains a particular pressure inside the eye to maintain its internal environment. And but this pressure, if exceeds more than 21 mmHg, normally this IOT is having 19 to 20 mmHg pressure, but if it exerts or raised more than 21 mmHg, then it creates pressure or tension in the other parts of the eye, and it leads to the pressure generated damage in the optic nerve, which ultimately leads to the blindness. So its etiology is unknown, but it may be due to some risk factors. Some risk factors are responsible for the glaucoma, and these factors are like elderly age, means if a person having age more than 60 years or more. Then second one, any patient history or its a family history. If a patient having its family history of having a glaucoma in any member. Third one, if a patient is suffering from some other diseases like high BP or diabetes, or if that patient having some long-term use of steroidal medication. So these are some risk factors which is associated with glaucoma. And glaucoma is a, you should know that glaucoma is a different than a cataract. So in Hindi ग्लोकोमा को हम काला मोतियाबिंद कहते हैं, जबकि जो कैटरैक्ट होता है उसको हम नॉर्मल मोतियाबिंद कहते हैं. नॉर्मल मोतियाबिंद में आपके आइज़ में प्रोटीन्स का डैमेज हो जाता है, जिस वजह से विजन प्रॉब्लम्स आती है. और यहाँ ग्लोकोमा में यानी काला मोतियाबिंद में आपके ऑप्टिक नर्व का डैमेज होता है, और इसका कारण होता है एक्वस ह्यूमर का आईओटी इंक्रीज होना, जिस वजह से आगे चलकर अंधापन आता है. और इसमें आपका जो प्यूपिल होती है ग्लोकोमा में, आपकी प्यूपिल डायलेट हो जाती है, क्योंकि इंट्रा ऑक्यूलर टेंशन के बढ़ने की वजह से वो प्रेशर आइरिस पे जाके लगता है और लेंस पे जाके लगता है, जिस वजह से लेंस बाहर की ओर पुष्ट हो जाता है. ठीक है, तो यहाँ पर ये बात थी हमारे ग्लोकोमा कैटरेक्ट में डिफरेंस की. अब हम ग्लोकोमा में वापस चलते हैं. सो देयर आर टू टाइप्स ऑफ ग्लोकोमा ऑन द बेसिस ऑफ द इरिडोकॉर्नियल एंगल. This about this I will discuss in the next slide. So two types of glaucoma based on the intra iridocorneal angle. And first one is a open angle glaucoma, also known as the wide angle or chronic simple glaucoma. In the picture A, you can see there is a angle between cornea and iris, but this open angle glaucoma happens due to the blockage of trabecular meshwork, which is responsible for the outflow of aqueous humor. And the second one is an angle closure glaucoma, also known as the narrow angle or acute congestive glaucoma. Here, as you can see, the trabecular meshwork is okay, but the angle become closed, and this iris comes in contact with the lens, and and that lens already pulled forward direction due to the intraocular tension, and all these things inhibit the flow of aqueous humor. So in this slide we are discussing about the dynamics of aqueous humor. So as you can see, this is the picture of a anterior portion of eye. So the space between a cornea and yellowish brown color iris, we called it anterior chamber, and the space between iris and lens called as posterior chamber. And this blue color arrow showing the direction of flow of aqueous humor. So this yellow part, as you can see, which is connected with the iris, is the ciliary body, and behind this pinkish yellow part is a ciliary muscle. So in this yellowish part, ciliary body, there's a ciliary epithelium cells are responsible for the production and secretion of aqueous humor. And this aqueous humor produced here and starts secreting from ciliary body to the posterior chamber, and from posterior chamber via pupil it comes to the anterior chamber and finally drains out through the trabecular meshwork. As you can see here in the right hand side, this trabecular outflow is written. So these are the micropores which are responsible for the drainage of aqueous humor. And behind this trabecular meshwork there is a slum canal. It represents a lymphatic vessel. It is a epithelium lined tube like structure which drains or collects all the aqueous humor coming from the anterior chamber through trabecular meshwork. And this is the red colored angle. You can see this angle we called it as a iridocorneal angle, and on the basis of that angle we divide glaucoma into two broad categories. And the aqueous humor which flows through this trabecular meshwork, we called it as a trabecular outflow. 80 to 90% of aqueous humor flowing through this. And there's another pathway also which is a uveoscleral outflow. As you can see that the from anterior chamber aqueous humor comes in ciliary muscle, and then from ciliary muscle it passes to the sclera and finally in the other lymphatic vessels. So this picture is all about the dynamics of aqueous humor. And one more thing, in a open angle glaucoma, this trabecular meshwork becomes blocked due to various reasons like blocking of a trabecular meshwork due to some contraction. And in the second one, in the closed angle glaucoma, it happens due to the intraocular pressure tension increases which pulls outwards this lens, and the iris is also become bulged, and its sphincter pupillae part comes in contact with the lens, so it blocks the pathway of a flow of aqueous humor. And that angle was also narrowing in that angle closure glaucoma. So these are the site of action of drugs which is used for the treatment of glaucoma, and mostly these are topical drugs except one which is acetazolamide, which is given orally. So here in the sphincter pupillae, as I told you that this region comes in contact with the lens and it stops the flow of aqueous humor, and this iris also bulges so that it narrowing the iridocorneal angle, so that the aqueous humor can't reach to the trabecular meshwork and it will create pressure. So this is the site of action of most of the myotics, and myotics are responsible for the contraction of this sphincter pupillae so that it detached itself from the lens, and also it opens up the iridocorneal angle. So it reverses the obliteration of a iridocorneal angle. And second part is the ciliary muscle. So in the ciliary muscle, it is the site of action of some myotics in the open angle glaucoma, so that these myotics causes a contraction in a ciliary muscle, which helps in the opening of a trabecular meshwork. And the site 3 is a ciliary body. Here the drugs like beta blockers, alpha 1 agonists, alpha 2 agonists, and carbonic anhydrase inhibitors acting here to reduce the formation of aqueous humor as well as their secretion from the ciliary body. And the fourth one is a UV scleral outflow. This outflow can be increased by the use of some prostaglandins on a ciliary muscle, so that it increases the permeability of that ciliary muscles for aqueous humor and also maintains pressure gradients. And the fifth one is the trabecular meshwork, and here some beta 2 agonists are working here, so that it increases the aqueous conductivity of a trabecular filtering cells. So this is about the classification of topical drugs used for glaucoma, which is categorized into 5 categories: beta adrenergic blockers, alpha adrenergic agonist, prostaglandins, carbonic anhydrase inhibitors, and myotics. So the trick for the remembering these classes is BA student got glaucoma while studying PCM. So B for beta adrenergic blockers, A for alpha adrenergic agonists, P for prostaglandin analogs, C for carbonic anhydrase inhibitors, and M for myotics. So the first one is beta adrenergic blockers. It contains 4 drugs which are betaxolol, temolol, levobunolol, and cartiolol. Its trick is beta TLC give me. Beta TLC give me. So first beta is for beta blockers, second beta is for betaxolol, T for timolol, L for levobunolol, and C for cartiolol. And the second category is alpha adrenergic agonist. So these are having 4 drugs: dapivirine, apraclonidine, brimonidine, and adrenaline. So its trick is Aji's Daba. Aji's Daba. Aji for alpha agonist, and Daba for D for dapivirine, A for apraclonidine, B for brimonidine, and A for adrenaline. And the third one is a prostaglandin analogs. Prostaglandin analogs having 3 drugs: latanoprost, bimatoprost, and travoprost. Its trick is Lataji is having Bima in a Trivago company. Lataji is having Bima in a Trivago company. So Lata for latanoprost, Bima for bimatoprost, and Trivago to travoprost. Next class is carbonic anhydrase inhibitors. Basically it contains 3 drugs, but one which is acetazolamide given orally, and these 2 drugs are given topically, which is drozolamide and brinzolamide. So its a small trick is a beggar having 3 assets. A beggar having 3 assets. What are these assets? These are car, AC, and do brinjal. Car, AC, and do brinjal. Car for carbonic anhydrase inhibitor, AC for acetazolamide, do for drozolamide, and brinjal for brinzolamide. And last class is myotics. So in myotics, 3 drugs are there. First pilocarpine, acothiopate, and physostigmine. Its trick is Pepsi. So myotics happen due to Pepsi. Trick is myotics happen due to Pepsi. Myotics means constriction of pupil. So it's just a trick. P for pilocarpine, E for acothiopate, and another P for physostigmine. And these are some points which are very important for your exams point of view. So this beta blocker drug. So this is a beta 1 selective drug, and it is a beta 2 selective drug, and it is a timolol. And this timolol is a drug of choice for open angle glaucoma. and this is preferred in a glaucoma because it doesn't cause side effects like other drugs like meiosis, induced myopia, ciliary spasm, and a fluctuation in intraocular tension. But this timolol is contraindicated in asthma patients. I repeat, timolol is contraindicated in asthma patients because it precipitates asthma. And mode of action of latanoprost in glaucoma is it increased UV scleral flow of aqueous humor. So latanoprost and other prostaglandins increase UV scleral flow of aqueous humor. That 10% one. So mode of action of beta blockers in glaucoma is it decreases aqueous secretion from ciliary body, means ciliary epithelium. And mode of action of pilocarpine in glaucoma means all the myotics having increased aqueous outflow by opening of a trabecular meshwork. So it increases the opening of a trabecular meshwork by increasing aqueous outflow. And acetazolamide we used orally. Brimonidine caused drowsiness. Mannitol infused IV and decongested the eye by osmotic action. And brinzolamide unsafe in infants. Apraclonidine causes lid retraction and pilocarpine causes spasm of accommodation. I hope this video is helpful for you, and if it is helpful for you, then you can like this video and share this video with your friends, and also subscribe this channel for the further upcoming videos, and comment me if you are having any doubts, or if you want to include some more information in my video, so you can comment me. And thank you all of you for watching my videos, and again thank you.